But before we get into those particulars, our committee thought it would be helpful to take a step back and ask what we mean by diagnostic excellence. By doing so, we can better understand our current capabilities and create expectations for what might be achieved through new approaches. To help us address this question, we've asked Dr. Harvey Feinberg, who is the president of the Gordon and Betty Moore Foundation, to provide us with a vision for achieving diagnostic excellence. Dr. Feinberg is well known to the National Academies, having served as the president of the Institute of Medicine from 2002 to 2014. You can find a more detailed bio for him and our other speakers in the workshop materials. After Dr. Feinberg gives his presentation, we will then have a panel of 3 speakers who I will briefly introduce prior to their speaking. They will each reflect on Dr. Feinberg's presentation and their own sense of what is meant by diagnostic excellence. With that, I turn it over to you, Dr. Feinberg, and very much look forward to your comments.
Well, thank you so much, Andy. It's a pleasure to see you and our panelists and the staff at the National Academy of Medicine and National Academies more broadly today. And really, this is a very meaningful gathering for me. Most of the time when I have initiated a welcome to a gathering at the Academies, it's been from my previous perch as president of what was then the Institute of Medicine. Now I come as a sponsor, which was the furthest thing from my mind at the time I was working at the Academies. This topic has a special salience for me as well. Not only has it been a subject of my own professional interest for decades, but as the president at the Institute of Medicine, in my final year in 2014, the topic and study that ensued on improving diagnosis that emerged in 2015 was among the last studies that we initiated during the period of time while I was still president at the Institute of Medicine. This study, in turn, stands in a long line of studies initiated at the Academies that deal with the quality of care, the safety of care, improving medical practice and healthcare outcomes. The continuity is also marked by a need for widening and focusing, both looking ahead. From the vantage point that we've adopted at the Gordon and Betty Moore Foundation, our patient care program has a singular focus on improving the experience and outcomes of patient care. In other words, it adopts fundamentally the vantage point of the patient in defining, describing, and articulating the goals of the work that we are now doing. We always want to ask the question, what difference will this make in the lives, experience, and health of our patients? In this connection, I want to say a few words of the way in which we think about diagnostic excellence specifically. First, diagnostic excellence certainly embraces the notion of an accurate, error-free depiction of the state of the clinical experience at that moment of the patient. It is certainly about diagnostic approaches that identify with accuracy and without error the nature of the illness and the specific character of that malady in the patient at that time. Our concept of diagnostic excellence, however, is broader than simply avoiding error or making ultimately an accurate diagnosis. It includes the ideas of the experience of attaining the diagnosis. So it includes attention to the diagnostic process. It looks at the question of the efficiency and the appropriateness of the testing strategy. It asks questions about the cost, both in terms of safety to the patient, but also the financial cost. It's concerned with redundancy and over-testing, as well as accuracy and completeness of testing which is undertaken. In other words, when we speak of diagnostic excellence, we are referring to the way the health system, the strategies, approaches, sequences of examination, all contribute to understanding of the patient's condition in a way that is safe, timely, efficient, as well as accurate. So all of these dimensions of the diagnostic process experience for us are fair game in the quest for diagnostic excellence. This is a very broad field. And in order to make progress, we at the foundation have chosen also a kind of vertical series of slices through this broad area of improving diagnosis. Vertical in the sense of the conditions of health and illness that could most dramatically affect the patient if the diagnostic process is not excellent. And the three areas that Dr. Beinman described as the sequential topics for the several workshops in this series are all selected because they focus on one of these major conditions where error, delay in the timeliness, or redundancy or inefficiency can create adverse outcomes for the patient. Errors, delays, and mistakes are especially costly when it comes to sepsis, cardiovascular events, and cancers. And that's the reason why we're going to be focusing on that sequence in the series. Today's session is dealing with a very challenging condition, even from the outset of defining the exact boundaries that one means by the concept of sepsis. Throughout the discussion, I hope that we will maintain that principle of focusing on the experience and outcomes of the patient. I also hope that our discussion will be forward-looking, not simply to retread and re-articulate well-established ideas and principles and practices, but forward-looking about the strategies, technologies, approaches, conceptual understanding, and practical steps that will take us closer to the goal of diagnostic excellence for sepsis. I'm especially grateful, Andy, to you and your planning committee for helping us to lay out the series. I really appreciate the time, expertise, and contributions of all who are participating in today's and the subsequent workshops. And I know we will all come away learning something that gives us new insight, new appreciation, and fresh ideas for how we can make the most progress on sepsis diagnosis and excellence in diagnosis in the years ahead. So with that, Andy, I'm going to turn the program back to you, eagerly looking forward to the comments, reflections, and ideas of our panel, and then to all of the contributions through the program that you outlined. Thank you, Andy. Back over to you.